Hello and welcome back. So in this video we're going to discuss how we manage the medications window or the medications calendar. So basically we already discussed how we can choose one of the protocols that are built in the system, or actually create or design our own protocols and add them to the medication window of the patient calendar for medications. Now we're gonna dig a little bit into the medications section to kind of show you all the functions that we can do there. So if we go there and click, these are the medications that were saved from the last session, and as we see, it's scheduled from 1 to 28. That presents the days of the cycle, and on the other axis these are the medications, so HCG, FSH, HMG, GnRH antagonist, and GnRH agonist. So basically, as we said before, the red color indicates that these injections should be given on these days according to the protocols that we choose to do. But the other thing is, you can always add more injections to this calendar by just clicking wherever you want. So for example, if you want to add the HCG injection when you think it's a good time for triggering, you just choose where is the injection, or what is a suitable day for that, and you just click once, and once you click it, it turns into a red color. So you can add actually some more injections on this calendar. And the other thing is, you can do the reverse, so you can actually decide not to give this injection. For example, you just double click on it and it's going to turn into a gray, and you can always delete the dose, or change actually the dose, so you can turn it into 150, for example. You can always modify the dose that is already written under each injection. The other thing is, if you're following up with your patient and you want to just be sure that she's taking her medications day by day, or you have a nurse that's actually calling her to check on these medications, you can keep track of these medications by just clicking like this, just once on the red injection, so it turns into a green injection, which for you means that this injection was given. So you can always keep track of your patient and be sure that she's taking her injections by the phone, and you just keep clicking on that as a confirmation that this injection was given. And this applies to any injections that's present in this calendar. So you can choose like this one and click once, it's going to turn into red, twice it's going to turn into green, and then one more it's going to turn into gray. And you can always write the dose under each of these injections. So this is one of the things you can do. And you have two buttons at the bottom of this chart. One of them is actually helps you to add a reminder for something. So if you click on it, it's going to open you a window, and you see that it's like scheduling injection. We're going to talk more about the calendars in a different video, but what I want to say is, actually you can always add a reminder of one of these injections, say for example the triggering injection. So you remind yourself and keep in the calendar of your center, and the calendar for the patient as well, that you keep an important date related to injection by clicking here and adding this to calendar. We're going to discuss this in a different video, but you can always add an injection reminder or highlight an important injection in the calendar of your center or the patient calendar as well. But anyhow, the other one actually helps you to save a picture or an image of this whole chart to be actually saved in the patient summary, which is going to be in a Word format, so you can print it and copy it and use it for different uses. And actually we're going to talk about how to create the summary in a different video, but what I'm saying is you can always export this image exactly as it looks to be saved in the patient summary, which can be in a paperwork, can be in her paperwork, and can be saved as a Word file. So that's basically how you can use a chart, how you can change the doses while you go, and how you can actually change the color of the injections to indicate whether this injection should be given, already given, or shouldn't be given. And that's pretty it for this part of the explanation, and thank you.